Modern healthcare feels permanent, stable, reliable, always there when you need it, but that sense of certainty depends on something most people never think about: continuous access, because the moment that access is disrupted, even briefly, the entire system starts to feel very different, and for people dealing with ongoing health issues, that difference isn't theoretical. It's immediate. At first, the system still appears intact, hospitals are still standing, pharmacies still exist, doctors are still working, but small cracks begin to show, appointments take longer to schedule, medications become harder to find, alternatives are offered more often, not because they're better, but because they're available, and most people adjust without questioning it. They assume it's temporary. A delay, a minor disruption, something that will correct itself. So they wait, they trust the system to stabilize, but the problem is, systems don't always recover as quickly as people expect, and during that gap, the burden quietly shifts from the system to the individual. Now, instead of simply following instructions, people start making decisions, small ones at first: when to refill, what to prioritize, which symptoms to ignore for now, and those decisions begin to stack, because healthcare, in its modern form, isn't just about treatment. It's about structure. It handles timing, dosage, storage, access, escalation. Remove even part of that structure, and suddenly you're exposed to variables you were never trained to manage. Take something as simple as medication availability. When everything is working, you don't think about supply chains, you don't consider where your medication comes from, how it's transported, or what happens if that chain is interrupted. But when it is, the impact isn't gradual. It's abrupt. One day it's available, the next day, it isn't. So people start adapting, they search for alternatives, different brands, different dosages, sometimes entirely different substances that are assumed to work the same way, and occasionally, they do, but often, they don't behave exactly the same, and that difference matters more than it seems, because the body responds to consistency. Even small variations can lead to changes in how symptoms appear, how intense they feel, and how predictable they are. So now, instead of stability, you get fluctuation. And fluctuation creates uncertainty, but availability isn't the only risk. There's also dependency on infrastructure. Modern healthcare relies on electricity, refrigeration, transportation, communication systems all working together at the same time. If one fails, others are affected. For example, certain medications require strict temperature control. If refrigeration becomes unreliable, effectiveness can degrade, not instantly, but enough to make outcomes inconsistent. And again, that inconsistency is hard to detect in real time. You don't immediately know if something lost potency, you just notice that results aren't the same. So you adjust, maybe you increase the dose slightly, maybe you take it more frequently, and without realizing it, you've entered a cycle of guesswork. Now layer on another factor, access to guidance. In a fully functioning system, when something feels off, you ask a professional, you get feedback, you adjust based on that feedback. But when access is limited, delayed, or unavailable, that feedback loop breaks, and without it, even small decisions carry more weight, because there's no immediate correction. No confirmation, just outcomes, and outcomes don't always explain themselves. So people begin to rely more on interpretation. They watch their symptoms more closely, they try to identify patterns, they attempt to connect cause and effect, and over time, something interesting happens. Awareness increases, but so does pressure, because now, every decision feels significant. Every change could help, or make things worse, and that mental load is something most people are not prepared for, which brings us to the deeper issue. The real issue isn't that modern healthcare systems are unreliable. It's that people have been conditioned to operate only within them. There's a difference. When everything works, that dependency is invisible, but when something breaks, even temporarily, it becomes obvious. Because the system wasn't just providing care. It was providing clarity. It reduced uncertainty. It guided decisions, and without it, people are left navigating complexity on their own. That's where risk actually lives, not in the system itself, but in the gap between system support and individual understanding, because when that gap is wide, even small disruptions feel overwhelming, but when that gap is smaller, when people understand basic principles, patterns, and responses, the same disruptions become manageable, not easy, but manageable, and that distinction matters. Because no system is immune to stress. No structure is permanently stable. The question isn't whether modern healthcare works. It clearly does. The question is what happens when it doesn't work perfectly, even for a short period of time, and whether you're prepared to operate in that space between full support and no support. If you want to explore this further, There's a structured breakdown in the description that walks through these scenarios in a practical way, including how people adapt when access becomes limited, and if you want more content that helps you understand how these systems behave under pressure, consider subscribing, because the more you understand the structure, the less dependent you become on perfect conditions.